Hi friends, today we are going to discuss about the histological image of the renal corpuscle and renal tubular system. So let's begin. So here we have the histological image microscopically, the renal corpuscle. The renal corpuscle comprises of the glomerulus, tuft and the Bowman's capsule. So this is what the Bowman's capsule, and they're making a space. This space is called as Bowman's space, and here we have the glomerular tuft. Okay, this is the glomerulus. So in glomerulus, as we discussed, that it comprises of the two contents, that interstitium and the cellular network, that is the capillary network. The capillary network, here we can see that these are the WBCs inside the lumen of the small capillaries. So here we find that here the RBC, and here is the nucleus of the endothelium. So this is the capillaries, okay, and here we can see the mesangium, and the mesangial cells we find somewhere. The mesangial cells, the mesangial cells have the function of producing collagen fibers, and produce in some time they act as a macrophage in inflammatory processes. And it mesangium, and the content of mesangium is very essential, because it regulates the glomerular filtration rate. For example, in some pathological conditions, in acute and chronic inflammations, the content increases, they release more collagen fibers, okay, they release certain cytokines, and they help in phagocytosis, and all these things in acute inflammatory processes, they increase, they proliferate in their amount, and this proliferation have a significant effect on the glomerular filtration rate, that it decreases the glomerular filtration rate. And about the Bowman's capsule is that the Bowman's capsule is surrounded by the parietal cells, squamous parietal cell, and a very fine cells we will discuss in next image, that are the podocytes. In between the two layer of the cells, we have a space, Bowman space. This space is always filled with filtrated fluid, and they have the hydrostatic pressure, and this hydrostatic pressure in the mesangium, in the Bowman space, is very essential for the glomerular filtration rate, because in some certain conditions the space filled with excessive fluid, or filled with scarring tissues, or filled with fibrotic tissues, okay, fibers, they fill the capsule, this space. For example, in if urine is obstructed, if the patient having the urine obstructive disorder, so in that conditions urine will not flow properly, and this increases the hydrostatic pressure in the Bowman's capsule, and this increasing in hydrostatic pressure into the Bowman's capsule, it greatly reduce the glomerular filtration rate. It cannot filter because hydrostatic pressure oppose the filtration mechanism. And in some conditions, for example, in membranopathy, or we can say proliferative or a chronic condition, there is the rapid disorder of the kidney, that is the crescent, in which the crescent shape fibrotic Bowman's capsule, we can see like it become fibrotic, okay, it will become fibrotic, and it become crescent shape like this. So in that condition, and the glomerular filtration rate very significantly reduced, and leading to the chronic renal failure. And another cell here we can describe, there is the tubular system around the capsule. Okay, here is the tubular system. So these are the tubular systems which are responsible for the reabsorption processes, and for the secretion mechanism. Mostly their function is reabsorption. So here we can see the proximal convoluted tubular cells, these are the columnar cells, and these are the nuclei of the columnar cells, and here we can see the content of the lumen, and here we have distal convoluted tubule. So in next image we will study further. So here we have highly magnified image of the renal corpuscle. It is the hematoxylin and eosin stain, in which we can see the nucleic acid or the nucleus blue, rather the proteinaceous region pink. So here we have the glomerular the Bowman's capsule, and here we have the glomerular tuft. Okay, here we can see a small layer of squamous cell, okay, with nuclei, and these are the parietal cell of the Bowman's capsule. Parietal cell, that is the simple squamous epithelium of the Bowman's capsule. And here we can see a Bowman's space, and these are the nuclei of the podocytes. Podocytes are the visceral epithelial layer of the Bowman's capsule. These are the specialized cell. They having food processes and filtration slit and provide effective filtration. Okay, and here we can see the lumen. Okay, this is the capillary lumen. Here the nucleus and some mesangial cells. So, and here in this image we have two more important structures, that is the vascular pole and the urinary pole. So what is vascular pole? Vascular pole is a point of entry for the efferent arteriole and exit for the efferent arteriole. So here efferent arteriole enter and efferent arteriole leave. Opposite to the vascular pole we have a urinary pole, and this urinary pole is a point from which the starting of the proximal cannulate tubule starts at this region. So urine formation, already urine is formed and it leads to the toward the proximal, so it is called a urinary pole. And here we have distal cannulated tubule. Okay, and these distal cannulated tubules, they having cuboidal cells and nucleus. Cell and nucleus. This is the cell and nucleus, and this is the glomerular tuft, and here mesangium. Our next image is collecting duct and distal cannulated tubule and thin descending and thick ascending loop. So the difference between the collecting duct and the distal cannulated tubule is that a collecting duct is a large tube, okay, than that of the distal cannulated tubule, because collecting duct receive many distal cannulated tubule or from many nephrons. For example, 8 to 10 or more than that this nephron, it ends their distal cannulated tubule into the collecting duct. So collecting duct, the size, if you cut the cross section, okay, we can see the tubular system like this, the collecting duct. Okay, and the cells of the cuboidal cell or the principal cell of the collecting duct, they're having a big nucleus, inside. So this is, we can see that this image is taken from the medullary region, because it is more prominent into the medullary region, and this is the lumen of the collecting duct, and this is the distal cannulated tubule, which is smaller in size than that of the collecting duct. Okay, and they also have the cuboidal cells here. The cuboidal cell having microvilli, but very less in amount in that of the proximal cannulated tubule, because 80% of reabsorption takes place in proximal cannulated tubule. Distal cannulated tubule is not so significant reabsorption, but it is significantly used for the reabsorption of water and electrolytes. And next we have here again the distal cannulated tubule, the content of distal cannulated tubule, okay, and very thin descending and ascending loop. So this is the loop of Henle cells, and this is the loop of Henle nucleus. So this is all about the renal tubular system and renal corpuscles. Thank you.